Good day, participants around the world. My name is Ayotunde Omotoso, and I'm a Nigerian psychiatrist, author, and public speaker. I'm the convener and founder of Yours Mindfully Official, a mental health initiative that seeks to provide information and prefer mental health solutions. You're warmly welcome to a virtual event, and the e-conference you're currently attending is the October edition of a monthly summit that we started in August. Incidentally, our first event held on the 8th day of the 8th month, while today's event is holding on the 10th day of the 10th month. And October 10 all around the world is recognized as the World Mental Health Day. And this year, the theme is mental health for all, greater investment, greater access. And using the global pandemic as the substrate for our subject, we have decided to target optimizing mental health for all in a global pandemic. And to put some context to the content we intend to share, this welcome address will now address the subject of optimizing mental health in a global pandemic. And to start off, I'd like you to know that the burden of mental health is actually quite significant, as the mental health burden in sub-Saharan Africa is enormous, with 14% of the global burden of disease being due to mental illness and other related disorders all over the world, really. Unfortunately, about 75% of this burden occurs in low and middle income countries, many of which are African states. And this burden is actually an actual burden, a direct burden, an indirect burden, a hidden burden due to stigma. And the burden is not just due to the presence of mental illness, but also the consequent loss of human and financial resources. There's a potential future burden which may ensue if nothing is urgently done to place mental health on the front burner. And that's why discussing this topic is actually quite important. The proportion of the health budget allocated to mental health is rather small. In most cases, especially in sub-Saharan Africa, less than 2% of the net national health budget goes to mental health. There's a paucity of human resources for mental health care. In Nigeria, for instance, Nigeria in Africa probably has the highest number of trained mental health professionals, and that's just about 200 psychiatrists across a nation of about 200 million people. So that means we have one psychiatrist to 1 million Nigerians. And of course, if we look at East Africa, Tanzania, and other countries, we would realize that the situation is even more dire. And so this time, we're going to be discussing the key problems, which would include stigma, migration, as well as the fact that the laws we have on mental health in this environment are actually quite obsolete. So to round off, we would have some suggested solutions. Some steps can be taken to enhance the skills of the professionals so that we can meet the needs of people in terms of their mental health even more. And these professionals here are the allied professionals whose skills can be scaled up so that we can meet more needs. The laws can be revised and adequate compensation made for mental health professionals. So when people have good mental health, the planet will grow. And on that note, we're going to be opening this discussion, knowing also that there is no health without mental health. I thank you very much for your attention.